For a long time, medical researchers were unsure whether Alcoholics Anonymous worked better than other approaches to treating people with alcohol use disorder. In 2006, a review of the evidence concluded we didn't have enough evidence to judge. That has changed, and that's the topic of this week's Healthcare Triage. Special thanks to Austin Fracht, who co-wrote the Upshot article from which this episode is adapted. To the research! An updated systematic review published by the Cochrane Collaboration found that Alcoholics Anonymous leads to increased rates and lengths of abstinence compared with other common treatments. On other measures, like drinks per day, it performs just as well as approaches provided by individual therapists or doctors who don't rely on AA's peer connections. The 2006 Cochrane Collaboration Review was based on just 8 studies and ended with a call for more research to assess the program's efficacy. In the intervening years, researchers answered the call. The newer review also applied standards that weeded out some weaker studies that drove earlier findings. In the last decade or so, researchers have published a number of very high-quality randomized trials and quasi-experiments. Of the 27 studies in the new review, 21 have randomized designs, and together, these flip the conclusions. Studies generally show that other treatments might result in about 15 to 25% of people who remain abstinent. With AA, it's somewhere between 22 and 37%. Specific findings vary by study, of course. Although AA may be better for many people, other approaches can work too. And as with any treatment, it doesn't work perfectly all the time. Rigorous study of programs like Alcoholics Anonymous is challenging because people self-select into them. Those who do so may be more motivated to abstain from drinking than those who don't. Unless a study is carefully designed, its results can be driven by who participates, not by what the program does. Even randomized trials can succumb to bias from self-selection if people assigned to AA don't attend, and if people assigned to the control group do. It may go without saying, but we'll say it. It would be unethical to prevent people in a control group from attending Alcoholics Anonymous if they wanted to. Despite these challenges, some high-quality randomized trials of AA have been conducted in recent years. One, published in the journal Addiction, found that those who were randomly assigned to a 12-step based directive AA approach and were supported in their participation attended more meetings and exhibited a greater degree of abstinence compared with those in the other treatment groups. Likewise, other randomized studies found that greater Alcoholics Anonymous participation is associated with greater alcohol abstinence. AA not only produced higher rates of abstinence and remission, but it also did so at a lower cost. AA meetings are free to attend. Other treatments, especially those that use the healthcare system, are more expensive. Cognitive behavioral treatments, which help people analyze, understand, and modify their drinking behavior and its context, are one example. One study found that compared with AA participants, those who received cognitive behavioral treatments had about twice as many outpatient visits, as well as more inpatient care, that cost just over $7,000 per year more in 2018 dollars. Another study found that for each additional AA meeting attended, healthcare costs fell by almost 5%, mostly a result of fewer days spent in the hospital and fewer psychiatric visits. AA meetings are ubiquitous and frequent, with no appointment needed. You just show up. The bonds formed from the shared challenge of addiction, building trust and confidence in a group setting, may be a key ingredient to help people stay on the road to recovery. Worldwide, alcoholic misuse and dependence are responsible for 3.3 million deaths per year, 10 times the number of fatalities from all illicit drugs combined. In the United States, alcohol is a larger killer than other drugs, accounts for the majority of all addiction treatment cases, and is responsible for at least $250 billion per year in lost productivity and costs related to crime, incarceration, and healthcare. Moreover, American deaths related to alcohol more than doubled between 1999 and 2017. Reducing the human and the financial burdens of alcohol is an often overlooked public health priority, and the new evidence suggests that on balance, one of the oldest solutions, Alcoholics Anonymous has been around for almost 85 years, is still the better one. Hey, did you enjoy this episode? You might enjoy this previous episode on COVID vaccines and variants. We'd really appreciate it if you like the video and subscribe below. And if you consider going to patreon.com/healthcaretriage, where you can help support the show even during a global pandemic. We'd like to especially thank our research associates, James Glasgow and Joe Sevitz, and as always, our Surgeon Admiral Sam.